Yeah, this is Robin from the Back Pain Secret Podcast. And today, guys, we are going to talk about surgery. Surgery on your back, okay? Should you have the surgery or shouldn't you have the surgery? Okay?
So here's the important question. How can back pain sufferers like us, who don't want to use prescription drugs or go through surgery, heal our back pain? How do we live our daily lives in a way that allows us to go to work, take care of our families, enjoy life, and still manage our back pain? That is the question, and this podcast will give you the answer. My name is Robin Wakeham, and welcome to Back Pain Secrets.
Guys, I get a lot of questions regarding this, okay, with surgery on your back, if you should have it or not. I get a lot of Facebook, people are contacting me on Facebook, on YouTube, on Twitter, on Instagram. It's crazy, okay? Also in the office here, that's one of the most common questions I get every day, you know. Should I have surgery or shouldn't I have surgery, okay? And I understand, it's a nerve-wracking thing to make a decision around, okay? So I've talked about this a few times on the podcast before, but still the questions are still there, okay? So if you heard some of the information, I'm mixing it up and going a bit deeper today, so bear with me, okay? So to give you give a more concrete example, I'm going to talk about Tom, okay? And I met Tom, which is who is a patient of mine, a few months back. That's not his real name. I made the name up. But Tom is an artist, okay? He's in a band. He sings. He's in his 50s. He's quite successful. He also paints, you know. He's a painter. He's an artsy guy, okay? He loves the arts. He's all natural. He doesn't like to take any pills. He doesn't like to visit the doctor or even visit me, you know. But he's in pain, big pain, massive pain, back pain. And with this condition that we're talking about, back pain, if you should have surgery or not surgery, it could be any condition you have in your back. It can be a slipped disc, it can be herniated disc, it can be many different back pain conditions. But in Tom's case, it was a herniated disc at level L4, L5, and that's in the lower part of the back. And the things that he was struggling with, he had radiation down his left leg, okay, all the way down to his toes, okay. He had weakness in his legs. He had tingling sensation between his legs. He had a bit problems with the coordination, okay. He didn't trust himself to run because he tripped quite often. Also, when he was walking up and down the stairs, that was also hard for him, okay. So he's struggling. Also, big thing, he had problems sleeping, okay. He was taking some pain medication, but he didn't want to take too much of that. So he was very, very nervous, you know, regarding this. So he'd been around now to a few orthopedic surgeons, 3 I think, and 2 of them told him that they recommended him to have surgery, and 1 told him just to hold off, okay. And then before that, he visited a bunch of different physiotherapists and chiropractors and osteopaths, you know, and everyone had their 2 cents about it, okay. So he came to me because my podcast was recommended from a friend. So he booked an appointment. He lives here in Stockholm, Sweden, and he came up and we had a chat about it, you know. And I said, so basically what he wanted me to answer, you know, he wanted to give me the pros and cons for operation and what I thought, you know. So he told me his story, and I told him, hey Tom, I can't really make that decision for you, okay. And that's true for all of you guys, okay. No one can make you have back surgery, okay. But there is some indications that you should have surgery and some indications for not having surgery. And that's what I'm going to go through, and that's what I talked with Tom about, okay. So first off, some reasons to have surgery, okay guys. If you've been suffering from back pain, I mean really suffering for 3 to 6 months, and I mean the pain is crippling. I mean you can't sit, you have problems sitting, you have problems standing, you have problems walking around, your sleep during the night is horrible, okay, and this has been going on for many months. That is an indication that you should absolutely think about surgery at least, okay. Also, if the time aspect, I told you like 3 to 6 months, and I mean that's a long time, you know. If you've been in pain, serious pain for 3 to 6 months, that's affecting your whole being, okay. You get depressed, you get sad, you have maybe sort of an anger inside of your body because you're not sleeping and you're just frustrated over the whole situation. That's also an indication that you that that, that that's you might be thinking about surgery at least, okay? And also the big thing is if you feel like this pressure on the nerve root that's causing this radiation down your leg is getting worse. I mean, you feel like the weakness in your leg is getting worse. You feel the coordination, meaning you have problems like when you're moving around, you're not really trusting your leg, is getting worse. And you have the radiation feeling is just increasing day by day, okay? That's also an indication that you should really be thinking about, like, listen to the orthopedic surgeon at least, okay? If you've been doing your exercises regularly every day, you know, you're going for your walks, you're standing up at work, you're trying everything, but nothing is working, okay? And you've done that over a period of time, then you might be like leaning to get surgery, okay? Then there is absolutely some reasons not to get surgery, okay? First off, I mean, it's a delicate part down here in the lower back, okay? A lot of shit can go wrong, okay? And I'm not saying that to scare you, that's a fact. So, I mean, when you visit an orthopedic surgeon, I mean, most patients that visit them, they recommend you not to have surgery at all, okay? And that's good advice, okay? You don't want to do something hasty. So that's like the first tip, you know. I mean, if you get like a acute herniated disc and that you're in a lot of pain, don't do anything drastic, okay? You need, if possible, to let it go a period of time, maybe 3 to 6 months. Try to walk, try to stand up, try to mix it around, you know. Try to change your lifestyle a bit, you know, to handle this naturally without getting your back cut open, okay? Then there's also, if you see another reason not to get surgery is over the long haul. They've done a lot of studies. So, like, if you have surgery, if you have two people and one has surgery and they have the same condition, and then one person doesn't have any surgery, and you have like a period of time between 5 to 10 years, if you see it over the long term, there's not any like big difference between the person that had surgery and the person that didn't have surgery, okay? But obviously there is, if you have surgery, most people have surgery because they're in so much pain, okay? They can't take the pain. So there's good stuff and bad stuff to consider. So I told Tom, to be very concrete here, Tom, first off, you've been in pain for 3 to 6 months, okay, and that's quite a long time, okay. You're telling me that you have problems with like urination and when you go for pee or poo, basically you can't hold it in. You need to go more often. You have like a scratching feeling inside of your thighs. You have weakness in your legs that's actually increasing. And that's what he confirmed that was correct. He had problems walking up and down stairs. He didn't trust his leg. His sleep was horrible. I mean, he was sleeping like 2 or 3 hours every night. His mood was getting worse and worse, you know, and it was definitely affecting his work because he couldn't travel with his band or what he needed to do, okay? So I definitely told him, you know, hey Tom, you should like, I'm leaning towards and obviously he'd been doing all of his exercises that he got from his different physios as well, you know. So I told him, you know, you should go back to the orthopedic surgeons, the two that recommended the surgery, and you should write all down the questions you have, all your fears around the operation, okay? And you should think about it seriously, maybe to have the operation. And he was asking me, can't you ask or answer those questions? And I told him, hey, I'm not on that level, you know. And that's also something that you guys that are considering surgery should think about, okay? Don't get the answers of your questions from a person like me. I'm not standing with the knife, okay? So like a chiropractor or osteopath, a physiotherapist, friends, families, fools, you know, don't listen to what they have to say, okay? They want to do good for you, okay? But they can actually hurt you. You need to ask those questions to the people, the man or woman that's actually standing and giving you surgery, okay? That's very, very important, okay? Okay guys, I hope that helps. I've rambled a bit, but this is a complex problem that many people of you have, back pain sufferers. So take care, I'll talk to you tomorrow. And guys, remember, you're just one step away from healing your back pain. Bye-bye.
Want more back pain secrets? Then go ahead and get your free copy of my best-selling book, Back Pain Secrets, at backpainsecrets.com. Inside this book, you will find my top secrets to healing your back pain without prescription drugs or surgery that have helped thousands of other people just like you.